mwenyeji wa Murang'a. Mzee aliye na miaka 72, mzee aliye na familia ya watoto kama 7. Lakini kwenye mwaka wa 2004 nilijikuta ni mimi ni mgonjwa, nikaenda nikapimwa, nikajikuta niko na virusi.
Majina ni Jane Jerry Maina, Mentamara. Wakati nilitestiwa nikatani positive, na kulikuwa wakati mgumu sana juu hiyo wakati hakuwa na kama Mentamara ama peer educator wa kukuongelesha.
I'm 24 years old, doing electrical and engineering diploma. I'm an artist in both singing and drawing. I have 3 siblings, sistangu mkubwa na brothangu mdogo na sistangu mdogo. Mimi mwenye ako katikati ndiye ako positive. So nilikuwa najua si mistake yangu, ni mistake ya kuzaliwa, but I kept blaming my mom.
Kuna wakati nilifika nikasikia niko na hiyo moyo, so niwe na mentor wale mama wengine, niko HIV positive, niko na mtoto ako negative, so na wa educate wenye wataishi na virusi wapate watoto wenye wako HIV negative.
So hiyo ni dia college, niliona sasa hapa lazima nianze kukunywa dawa. Bado nitataka kukua na familia. So hapa nikaanza kukunywa dawa. Payroll yangu ilikuwa juu around 36,000. Kaanza kuteremka pole mpaka ikafika around 62.
For me, I would want to give a CHS story in a different way. And I want to say that for us is both a happy and a sad moment. Because for one, when you work with a partner who is very reliable, extremely reliable, for a duration whereby you are not, whatever you trust them to do, whatever you agree to do, you're not concerned about their performance. So I think for us today, as I give this interview, I'm both sad and at the same time I'm excited because of what we've achieved together.
Tegemeza Plus was funded by CDC to implement high-quality prevention care and treatment programs in Central Region. We started with a total of 87 facilities. So we instituted several measures to ensure what we call continuity in care. So number one, we start with HIV testing services. And when I say HIV testing services, there's also linkage. So HTS and linkage. And then there is care and treatment, so making sure that people are put on antiretroviral therapy, but then sustaining that as well. So when I say sustaining, there's an element of, which I'd call number 3, adherence, retention, and psychosocial support for the patients.
CHS tulianzana nao 2012. Walinipa kazi ambao kwa mwanzo niliajiriwa kama peer educator, ikawa naweza kuhamasisha kuzungumza habari ya virusi nikiwa na wenzangu hapa hospitalini. Pia wakanipeleka shuleni na nikasoma, nikawa mtu ambaye alikuwa anazungumzia habari ya prevention with positive. Wakaona ninafaa, wakanipa na kazi ya linkage officer. Bado wakanipandisha cheo, wakanipa na kazi ya HTS ambapo nimekuwa mshauri kutoka kwenye mwaka wa 2014 mpaka sasa.
For me, I joined Autism from the first way niliintroduce huku. In fact, motivate sasa niliona wanakuja na tunapewa uji, chai na pesa. So CHS ilituita last year, ilituita training. So after training, I had this idea. Bwana tutengeneze club ya UTZ ikuwe ni club yenye hata ukikuja huku unaenjoy, utataka kumiss. So I had this. Bwana tusitengeneze tour. So hii tour yenye tulienda tuliongea mambo mingi juu mi aim yangu ilikuwa ya tuende tufly yetu, ilikuwa tuende tuongee katikati. In fact that group yenye ilienda tour, they are now the one who are talking to others.
The number 4 is prevention of mother to child transmission of HIV.
Wakati wamama wamekuja ENC clinic, kuna program ya elimination of mother to child transmission. So ukijua bado uko HIV positive, tutaendelea na wewe, nitatembea na wewe mpaka mtoto afikishe 2 years na atakuwa negative.
Then number 5 is support for TB and HIV integrated services. In this region, about 18% of the TB patients are HIV positive. And so we have to take care of both those conditions. Number 6 is support for cervical cancer screening for women aged 25 to 49. Number 7 is working with key populations, female sex workers and men who have sex with men. There's an element of prevention, so PrEP, pre-exposure prophylaxis. And then the rest is lab support, so the diagnostic aspect, right from case finding to monitoring the patient on treatment to seeing the treatment outcomes, viral load assessments.
CHS has actually collaborated with the Ministry of Health and the National TB program to come up with Tiba Tegelezi. Tiba Tegelezi is actually a web-based and mobile-based application. It has the functionality of bidirectional screening, and in that sense, you're able to diagnose both TB and COVID in a bidirectional manner.
We've also done a lot in terms of barcoding, making sure that samples are barcoded before going to the testing labs. Patient identification is actually captured exactly how it appears in the Kenya EMR, and because of these, errors have been eliminated, and patients are getting results within the short period of time, because turnaround time during this particular, when you're using this program, is actually shortened because there's not a lot of human interactions with the samples and even the request forms. Partners with the county government of Murang'a, whereby the counties are providing the motorbikes and also hiring the staff to transport samples from the small facilities, that's viral load samples, sputum samples, gene expert samples, to the hubs, testing labs within the counties. And also we've also rerouted these samples to the testing labs in Nairobi. So this has been done very well for the last 3-4 years. And actually, let me say, for the time CHS has been here, that has been a very good program.
As you know, one of the areas that CHS has supported a lot is on human resource for health. As you know, government alone cannot be able to do this. And I want to tell you that if you go to the 34 supported sites, you will actually acknowledge that during this period, there was a lot of investment from both government and CHS. We were able to engage the County Public Service Board, and CHS was agreeable to the fact that instead of us going out there and recruiting new staff, we were able to, we just had a concurrence with the board, and CHS was able to transit this staff to the county government, so that now a suitability is done, and that within the kind of investment that has been done over the period is not lost.
We are truly proud of all the things we have achieved. We are proud because people who are supposed to be reached with these services have been reached. We are proud because there are generations that will forever be indebted to the work that we have done together collaboratively over these years. And we are proud that we have left a mark that will continue to be of benefit to those who come even after we are long gone.
This is a sweet, bitter moment because we are bringing to almost a conclusion a 10-year journey where we have had quite close collaboration between ourselves as the county government of Nyeri and CHS. We have really benefited a lot from this program. CHS has spent in excess of 492 million Kenya shillings They have supported 34 of our facilities. But we want to really say that their footprint will be felt for many, many years to come, because really the infrastructure will be left behind. Patients have benefited, and we as a government have also benefited, especially in the provision of proper healthcare and affordable healthcare to our people.
A big thank you to PEPFAR, a big thank you to CDC Kenya for the immense financial, technical support that has enabled us to implement this project, targeting our beneficiaries. A big thank you to the Ministry of Health, to the departments of health within the counties we have served. And we truly remain committed to Kenya's goal to control the HIV epidemic. Even though we close this project, it's just a phase. We believe the fight continues, and we are a committed stakeholder to achieve this goal for the country and for the people of Kenya.
I really want to wish them well and thank them greatly from the bottom of my heart on behalf of the people of Nyeri. So thank you very much. Thank you, CHS. Thank you for your cooperation, coming and working together with us. This is a memory we will keep for long.
Dada yangu, kaka yangu, wewe unayenisikiza kwa sasa hivi, tafadhali
chukua control ya maisha yako.
Jua hali yako HIV, utapata mtoto wako HIV negative.
Pamoja tutafika kilele.